You are watching Co-op for Two, broadcasting live from Champaign, Illinois, Wednesday evening, March 20th, 2024. Today we're playing the second proper patient in Medical Mysteries, New York City Emergency Room. This is one of these games with these multiple titles. Not sure that's the best way to do a game. I apologize for the oddity with the stream. Sometimes I forget how to do this stuff, and I started the stream and then I tried to stop it, but it ended it. Okay, but here we are. Let's give everyone a chance to get back to find us. Let me check in with the chat here. A little last minute modification to the board game shelf. Had a minor catastrophe there. What's going on today? It's like I haven't been doing this for 3 years. In 2 weeks from today, March 31st, a little less than 2 weeks, I'll be doing the 3rd anniversary of the channel update, live Q&A. I'd love it if you could join me for that if you've been participating in any of these live streams. It'll be the normal thing. I'll just do a update on the channel. I'll talk about plans going forward. We'll take some question and answer. If you have questions that you'd like to send me ahead of time, because you won't make it live, it's scheduled for Sunday, March 31st at 1 p.m. So if you have questions ahead of time, there'll be a thread on the Board Game Geek Guild for the channel or on the community tab on this YouTube channel. You can find a link to the Board Game Geek Guild on the About page on YouTube. You could submit those ahead of time, but I do hope you can join me live for it. What else do we need to catch up on? So, Medical Mysteries. I have been very impressed with this game so far. And I don't know, maybe there needs to be a name for, there's occasionally you encounter a game that's in a slightly different genre that you're used to, and there aren't many games that are in that niche, and that makes it all the more special. And this feels like a proper medical mystery game. And there are a lot of things done well here. It almost feels like occasionally you play a game and you get a feeling like, this is more detailed, more polished than could have come from just a new game designer. It almost feels to me like this was training material that was actually developed by people with some experience in the medical field as training. Like, you could imagine this would be used as a training game for new doctors or med school people. And I'll have to post a spoiler-free review when we finish playing through it. So far, I've been very impressed with the mechanics and everything about it. The only knock on it so far is that the tutorial and the first case we played have been a little easy, although it was enjoyable to solve the last case. But you can see on the box here that there's 4 patients in the box. We're playing patient 2. That the first patient was easy. We've got 2 that are medium. We're playing 1 today, and we'll play 1 on Friday evening. And then we'll have 1 that's medium difficulty. Now, this is interesting. I mean, like, you've invented this new game. These are the first cases ever. But they obviously know that, okay, none of them are super hard, but I really hope that they make more of these and they make some really hard ones. Everything is good about this system. There's absolutely no reason for them not to make more of these. I hope this catches on. And it does feel like this would be a great present for people interested in medicine and a great game to bring to family members who don't normally like mystery games. And a little bit of my bias is coming through here, which, you know, one of the surprises of this channel, well, let me not, I gotta save stuff for the, I gotta save stuff for the channel update on March 31st. So let me not go into any side issues. I'll just make a note to talk about that on the 31st. I do hope you'll join me on the 31st for that. And I'll have some things to talk about, a little update to Patreon ideas. All right, so hopefully everyone who tuned into the previous stream that I broke has made their way to this follow-up stream. Maybe I should have posted a comment there. Okay. Shall we get into this? Anything else anyone wants to talk about? I guess the only other thing I wanted to mention was that on Sunday, this Sunday, I think maybe we'll play the 4th patient case on Sunday after our Dear Homes session at 3 p.m. or before. So keep your eye open on Saturday for when we're going to stream the 4th patient case. Probably on Sunday. But if you haven't joined us for any of the play-by-mail Dear Homes cases, on Sunday at 3 p.m. at our normal time, we'll be reading the final letter. And this case has captured the interest of the audience. There feels like there are some bugs in it, and that may be contributing to why it's so compelling. But some pieces of mystery that have really got the channel discussing theories. And if you're interested in discussing theories and working on puzzles and helping us decide what games to play, you could drop by the Discord for this channel. There's a link to that in the About page as well. Okay, here we go. Case 2. Your normal caveat that if you think you might want to play this, you can only play these cases once, then the mystery is solved. So you might want to dip away and pick up this game yourself and come back and watch this stream after you do. All right, so we've got our core rules. This is not a game for hypochondriacs. I noticed after playing the first case yesterday, like you're like theorizing that what symptoms people have, and it does make you question yourself. Like, what about when I was out of breath or my heart rate went up? It does make you, makes me a little, triggers a little bit of that in me. So if you have someone who's a hypochondriac, don't get them this game. You're going to cause trouble. Okay, so we need our basic stuff here. We've got all of our guides, medical guides, information. We've got our code book. And then the rule book, which we shouldn't need. Okay, and then I'll keep this handy in case we need this. We've already learned about the gallbladder. Although we didn't really learn what that does for you. Okay, so let's get our area organized. And here we go with our case for today. Patient 2. Maybe I can give you this on a full screen. Okay, your next patient is Adrian Alexopoulos. Alexopoulos. Sounds Greek. He's brought in by his wife, Thea. Adrian is out of it and can't speak. Fortunately, Thea has a story to tell. Quickly open this envelope and check the contents. You also need results code booklet and the 5 research sheets from the codes research rules envelope. Leave the epilogue in this envelope. Okay, so we need our 5 things here. We have them all 5. I like how it's like quickly. It's like already starting you out like this is a medical emergency. Don't F around. Okay, he's out of it. He brought in by his wife. All right, so let's get out. So you basically get out everything but the epilogue. Okay, so we've got his intake form, his cards, and his sheet. We leave the epilogue to the side. Okay, it's our normal thing. It's the same report that we always use. The cards, which we can set aside for now. Okay, then we've got his intake interview. The intake interview is sort of duplicated, it feels like. Like he's got, they all have admittance exams and intake interviews. I guess the interview is you talking to them, and then the admittance exam is like the write-up by whoever checked them in. Okay, and then I guess we start here. All right, here we go. Adrian Alexopoulos. Age 82, male. Thea, a few years younger than her husband Adrian, meets you at the examination room door. She's crying and is distraught. Doctor, thank goodness you're here. My Adrian, I don't know what to do. He wouldn't get out of bed until afternoon today, except to go to the bathroom. He's miserable, but he's a tough guy, so he won't show he's having a hard time. He keeps saying he's fine, but a wife knows these things. Thea talks quickly, and it's hard to follow her thick accent. Considering how upset she is, you realize that listening and letting her talk may help calm her down. Thea continues. He's been to the bathroom so many times today I've lost count. Tonight at dinner, he didn't want to eat my lamb stifado. I knew something was wrong. He loves my stifado. Who wouldn't like stifado? It's a slow-cooked stew made with lamb shoulder and onions in a sauce spiced with cinnamon and cloves. I've been making it for almost 70 years, she says proudly. I even made Adrian's favorite, Savacchio pita, made with almonds because I don't like nuts. So you can imagine how concerned I was when he wouldn't eat any. Okay. He kept saying he was fine. He's so stubborn. He'd never admit he was sick. He wouldn't want me to think he's not strong. She wipes her eye. Stubborn old man. His mother warned me when I married him. My son is stubborn like a brick wall, she used to tell me. When he was a boy, he had his mother make his favorite snack after school every single day. A banana with a smear of peanut butter. Something to give him a little energy to keep up with his older brothers. He is quiet for a moment, something you sense rarely happens. Then she says, he's been sick like this before. It usually happens after he goes golfing. I think he's eating some junk at the club that doesn't agree with his stomach. But tonight he's got me really worried. It's worse than it's ever been. He wouldn't even argue with me about calling the doctor. And then Thea breaks down and is unable to speak for a moment. I heard a crash and found Adrian lying on the bathroom floor. He was bleeding from his head. I couldn't get him to sit up. I called the ambulance immediately. Adrian didn't say a word the entire way to the hospital. She grips your arm. Please help my Adrian. The patient is confused and lethargic. He's unable to understand or answer questions. His wife, Thea, is more than happy to tell you anything you want. Okay, so let's just review this for a second. First of all, they're elderly, and she's a little out of it. A little cognitively, she's a talker. She's not focused. She's given us all her recipe stuff. But we know it's not something he ate at home. She makes that every day for him. The more interesting observations here, clues are, he's constantly going to the bathroom, right? So he's constantly going to the bathroom. That's the first thing. I guess that's all on the second page. What was the other little clue we had? First of all, he may not want to admit to stuff. He's sort of proud and whatever. Okay, so he's constantly going to the bathroom. And it sounds like maybe she suspects it's something he ate because this has happened before. It's usually when he goes golfing and maybe he's eating something that upsets his stomach. That's her theory. But then the most important stuff for us in terms of symptoms and treatment is that he's fallen. So there's a couple of important things regarding that. First of all, it's a clue about his symptoms because something has made him fall. Like he's lost consciousness, he's gotten lightheaded, and he's fallen. That's a symptom to his underlying problem. But the other issue for us to consider is, has he had a concussion now? So if we're looking at his symptoms now, like he's lethargic and confused, we've got two things going on, right? One is his original problem, and then we may also be now seeing symptoms of a secondary incident, concussion. Yeah, in the channel, there's a comment about the nut allergy. She just says she doesn't like nuts. She doesn't say he has a nut allergy. And the going to the bathroom constantly does not sound like an allergic reaction. That sounds like maybe something else. There's some suggestion in the channel about diabetes, undiagnosed diabetes. And his favorite snack, banana butter, peanut butter. That is stuff you would give to someone with blood sugar issues. So that's not a bad guess. But I'm not aware of diabetes causing stomach problems. Okay, but we got our two issues. Let's remember he may have a concussion. Concussion is a little bit of a dangerous situation. It can look like everything's fine, and then all of a sudden they've got bleeding in the brain and they're dead. Confused and lethargic, that's his condition. Okay, so you remember how this game works. We start out with a story card and a condition card. So he's always in some condition. Don't pay any attention to that. So his initial condition is confused and lethargic. All right. Let us read the story card. So these are our initial interview questions we can ask the wife about. We can ask what happens when he goes golfing, because she says this problem comes up occasionally. Who has he been in contact with since he first had symptoms? I'm not sure why that's relevant. What has he eaten in the last week? And we could follow up and ask her more questions about how he's been sick like this before. One action for two questions, like our last case. Okay. Then we've got this telling us about sort of tests we can run. Boy, it's really sensitive about these cubes these days. Okay, and then we can look at his record here. Let's take a look. 82 male, 5'10", 170 pounds. He's a retired gardener. Okay, so we've got a new head injury from falling, bruising, cut, confusion, and lethargy. He's got diarrhea, and he's been going to the bathroom 7 to 8 times per day. Okay, so this is important. When I read he was going to the bathroom constantly, I read that as that he was urinating constantly, pointing to kidney stuff. But no, it's diarrhea. So does sound like a stomach issue. Okay, not travel, no recent interest, no recent illness. Okay, medications. He's taking lisinopril for blood pressure, high blood pressure. He's allergic to penicillin, contrast dye, and bee stings. Okay. Temperature looks normal. Heart rate looks normal. Blood pressure seems high to me. These seem okay. No recent antibiotic use. He does have high blood pressure. He had his appendix removed. Appendix is one of these mystery organs that we don't fully understand what it's good for. There's some interesting theories about it. 2 children, both healthy. No history of heart disease. He is Greek. Okay. Let's turn this over and read the rest of this. Okay, he appears confused and lethargic, doesn't speak or respond to questions. That's the concussion that I'm worried about. Pulse is steady, no contact with sick individuals. Wife not similar. Okay, so this is all stuff that you would ask to see if he had some infectious disease that he's caught from someone. He's cooperative, normal respiratory. Eyes are sunken, no changes in vision or hearing. Mucous membranes are dry, no sore throat, neck stiffness, or tenderness. Pulse is steady, heart rate is increased, no palpitations or chest pain, no heart murmur. Capillary refill, 2 to 4 seconds. I don't know what that's about. Joint pain, okay. Abdomen soft, non-tender, no palpable masses, no swelling in the extremities. He's got skin turgor, elasticity slow. So you test the skin to see if it rebounds. I think that just sounds like an age issue though. Okay, but here's our important thing. Gastrointestinal. He's got diarrhea that's non-bloody 7 to 8 times per day for 4 days. So it's been going on for 4 days. So he's got a real stomach problem. He gets diarrhea every couple of weeks that typically lasts for 2 days. So this is important. He's got a history of getting diarrhea occasionally. That does sound like maybe it's some allergy that he's having a strong reaction to. She seems like she could have some kind of Alzheimer's. So if there's something she's not supposed to put in his food, she might have put it in his food. Doesn't have a fever and doesn't have vomiting. That's a little odd. Appetite. Usually loves to eat, but not in the last few days, and he's lost some weight. Possible ingestions. He and his wife ate out at the golf club last Saturday. They shared the steak. Okay. 4 days. Let's remember that this has been going on for 4 days. Extreme diarrhea for 4 days. Okay. Genitorinary. Don't know what that is. No itching, burning, or pain with urination. No hematuria, blood in urine. Intake of fluids. Always has his coffee. Dark urine in small amounts. Total urine output unknown. Ugh. Okay. This is not for the faint of heart, this game. Okay. Mainly gastrointestinal diarrhea going on for 4 days. That's important. Wife genuinely cares for him, so it's not like she's poisoning him purposefully. Channel is joking about giving him a pregnancy test. Okay. So I'm concerned about doing preliminary concussion check, but let us look at our research guides and see if there's anything about gastrointestinal stuff and maybe allergies. Not allergy. Allergy's not quite the right question. Let's see if we can't look up a little bit about diabetes, gastrointestinal issues, and concussion. So, not heart related, not blood, procedures. Oh, is there a procedure here for specialist? Okay, so sending him to a gastroenterologist seems like a very good idea. I want to talk about the specialist thing for a second here, but in a minute. Let's first go here. Let me look a little bit about concussion. Confusion, lethargy, imaging or testing depends on the cause. Stroke or traumatic brain injury, do a CT scan. Dehydration or low blood sugar, do a lab chem 7. So I think the channel's theory that it could be diabetes undiagnosed is a strong one. So I think a Chem 7 set of tests, which are here, 7 different substances in the blood, glucose, to see if he's got low blood sugar might be a good idea. I'm not sure it would be my first choice, though. Let me see if we've got concussion entry in here somewhere. Here. Traumatic brain injury or head trauma usually results from a violent blow to the head. Mild traumatic brain injury may affect the brain cells temporarily. Symptoms include headache, nausea, fatigue. He doesn't have any nausea. That's significant. But a CT scan could pick up whether he's got bleeding in the brain, concussion that we have to worry about. So that suggests maybe a CT scan. Now, he's been home. It's been happening for four days, though. But remember, he just hit his head, right? So the underlying problem for 4 days, but the concussion right away. Okay, let's look at this. Diarrhea, loose, watery, possibly more frequent bowel movements, lasts no more than a few days. If it persists, it usually indicates there's an underlying problem, irritable bowel syndrome. He does get diarrhea regularly. So irritable bowel syndrome, is that something we can test for? Look at that. You could send him right in for a craniotomy, highly invasive test where the surgeon removes a sample of the patient. It'd be interesting to play this game and just do these crazy things. So if we did want to send him for a CT scan, where's the, oh, here. If we did want to send him for a CT scan, first choice to identify disease or injury, particularly complex bone fractures, head trauma. So I want to talk for a second. Heat stroke is a theory. So he's been having diarrhea for 4 days. We see an irritable bowel syndrome, but we don't know how to test for that. So the one thing that's, I guess if you were, first of all, the mechanics in this game are very impressive. And the whole issue with, you've got limited time and then events trigger. There are a couple things that seem odd or maybe a little imprecise in that mechanic here. It often seems like, yeah, let's just send it to specialists. It takes no more time than just giving him a blood test, whatever, and no extra cost. It does feel like to make this game a little more, to make these decisions a little harder, you might have these things take like a full day and be very expensive, because it just feels like it would take this is almost like getting a hint, and it's just, these are too easy. If you have to balance cost, it feels like these are easy decisions to make. So, and I'd love to see, the other thing is, the tests are instant. I'd love to see some system where, like, you get a delay before you get the results, and these take a longer time. Like, you'd have to send him down across the street or down to a different floor to meet with a specialist. It would take a lot of time. Channel has a very good point here. CT scan uses contrasting dye, which he's allergic to. That's a very good point. So he's allergic to contrast dye that you would use on a CT scan. Well, that's a very good catch. Contrast is dye. Well, hold on. Contrast dye is used for most abdominal and pelvic CT scans. But that's not for the head. That's tricky. I guess we ran a CT scan, can we say we don't want it done on the stomach, but we want it done on the head? That's an interesting thing. Let's look at our choices here if they give us a choice. So we could run a CT scan, and we could, there you go, look at that. CT scan or CT scan abdomen. Look at that. Okay, so these are different for the different patients. So we wouldn't run a CT scan on his abdomen on his head. So I think that wouldn't use contrast dye. And then we could run a Chem 7 and check for low blood sugar. Or we could just give him an anti-diarrheal right away and just solve his problem. Like, he gets diarrhea occasionally. He's just had a bad spout of it. Okay, so here's what I want to pitch. I want to pitch that our main concern is not the stomach problem. I want to pitch that our main concern is that he's got a concussion from falling, and that's our primary worry. So I want our attention to, as our first task, before we start sending him to a gastroenterologist, I want us to make sure he's not got dangerous head injury. So I want to pitch that we send him for a CT scan and look for head trauma. I mean, we could send him to the neurologist, but I just feel like let's rule out the danger situation first. Let's rule out the immediate dangerous situation. He's been having diarrhea for 4 days. I do think it could be low blood sugar diabetes, but let's do the CT scan first. Is there any questions we want to ask before that? Golfing, that could be. So how long, who's been in contact with? No. Eating, not really. So the only other thing I wanted to double check is if she described his symptoms differently before he fell. He's been sick like this before, something in his stomach. Tonight he's got me worried. It's worse than it's ever been. He wouldn't even argue about calling the doctor. Okay, so he is in whatever. His stomach really is bothering him, so it does need to be treated. It's serious. But this couldn't get him to sit up. That's much more serious. Okay, so is everyone on board with a CT scan? I mean, we could give him fluids and anti-diarrheal right away. But it feels like if you're going to do a CT scan, do it now. But we're not gonna give him any contrast dye. So if the CT scan technician says, I normally use contrast dye even for the brain, then we'll say no. There's some talk in the chat about dehydration. That's all true, but remember, he's been home for 4 days, so he would have been getting liquids. All right, we're doing the CT scan. Here we go. Remember, if it says we need contrast dye, we're not going to follow through. All right, CT scan in our first shift, midnight to 2 a.m., is EDC. Okay, there's some joke on the channel about my handwriting already being consistent with the doctor. So I don't deny it, but I'll try to write. Okay, CT scan, EDC. All right, let's see what we've got here. Story card 14. I'm going to look at it because if it says we give him contrast dye, I'm not going to do it. Okay, well, here it is. Neurologist says, compared to scans from when he was 42 years old, it's clear this patient has brain atrophy. Look at that. They're comparing here. Brain atrophy is likely due to normal aging, probably some from dehydration. However, he does not appear to be at risk for stroke or brain injury. Okay. So I guess we're going to not worry about possibility of concussion. Remember, there was a cool thing in this game in the scoring where you don't just get scored for figuring the right thing out. You also got scored for doing tests to eliminate things. So I feel like this was still the right thing to do. Okay, so it doesn't look like we have to worry about concussion, brain damage from the fall. A little hint there about possible dehydration. So that's our now immediate concern, that it's probably blood sugar dehydration making him lethargic and confused. So I think maybe IV fluids wouldn't be a terrible idea. Let's look up about IV fluids, what it says. Specially formulated liquids that are injected into a vein to prevent or treat dehydration, sepsis, and acute kidney injury. They're used in people of all ages and have a low risk of complications. So I'm thinking maybe we just start him off on an IV drip, and then we'll run some blood tests. I mean, it's not gonna hurt. And if he is dehydrated, it should have immediate improvements. So I'm going to suggest that it's a little odd choice not to diagnose him better. But given the severity of his symptoms, given the high likelihood of dehydration, and given the low risk of complications, I think we should put him on IV fluids while we continue researching this. What do you think? The only thing you could argue is if we did the blood test first, we'd know what to put him on better. What are these drugs? These are almost like hints. I'm not going to look these two up because those feel like hints about what to consider. One of these might be Floxin. This probably is an antibiotic. You could tell by the suffixes. You could probably guess what some of these are. IV fluid's a good idea, says the channel. Okay, let's put him on an IV fluid. Nothing bad's going to happen from that. It's not going to cause an allergic reaction. Okay, YGG. So we're going to put him on an IV. All right, let's see what happens. Let's see if we can improve his state enough that he can answer questions. It says story card 5. Suppose the only risk here is that we're eating up time when he's getting sicker. Okay. Look at that. Looks like that helped. The IV fluids help Adrian recover from his dehydration. Almost immediately, Adrian becomes more alert. He's still not talking, but his cheeks are flushed, and you hear him laugh at something Thea says. Thea's crying, going back and forth between thanking you and asking Adrian how he's doing. Now you can address his mysterious sickness. So we've changed his status from lethargic and confused to alert but still sick. So good work to the team. That was the right thing to do. I feel like our choices were good. Like immediate concern, PET scan. Next concern, IV. Maybe we should have put him on an IV as the first thing so that we could talk to him if that was what it was about. But we were concerned about head injury. Okay, he's alert, but he's still sick. Okay, now we can deal with the stomach issue. It almost feels like we should be able to ask him questions now. Isara says his urine color sounds concerning. Yes, you're right. That did sound a little concerning and confusing. Dark urine in small amounts. What does that sound? But it said no blood in the urine. That's odd. Dark urine, but not bloody. Probably a doctor will know what that means. If there's no blood in the urine, but it's dark, what does that mean? It may mean it's leaching out vitamins, minerals, like it's leaching stuff, trying to get, or it may mean there's some injury, but it might be a clue, but it sounds like, so it's a little odd because like, I guess our theory of diabetes is less dominant now. It was dehydration due to diarrhea, due to stomach issue. So now we're sort of back away from diabetes, back and blood sugar to more of a gastrointestinal problem. So it seems like our best bet might be to send him to a gastroenterologist to me. And Tina says it was because he was dehydrated. That's why the urine was dark. That makes some sense. Jesse, what does a stool culture get us? Okay, yes, that's a good idea. We haven't seen that before. Let's look up stool cultures. Bowel movement test to detect bacteria that cause infection of the lower digestive tract. That's fine, but it may not be so easy to test that. It's a little gross, but I guess if he's having diarrhea, we could test that. But bacteria seems unlikely. It doesn't match our, what's the word for the set of symptoms? It doesn't match our environment. He hasn't been traveling. He's been hanging out with his wife. It doesn't feel like a bacterial infection, and it happens when he goes golfing and stuff. So it wouldn't be crazy if it was an allergic reaction to something he's eaten. But we don't have a test for that. I think gastroenterologists make sense. It's sort of outside of our expertise. But you could also argue that we should just give him an anti-diarrheal so he doesn't get worse. So I mean, if it's all about dehydration because he's having diarrhea, maybe I'm a little concerned that might. Let me just see here. Do we have an entry for anti-diarrheal? A drug used to slow down or stop diarrhea. Caution should be used if the diarrhea is caused by infection, as it could cause the infection to worsen. That's why not to give him this, because we don't know yet. All right, let's send him to... DJ Moneycut says not speaking is a brain problem, so I say neurologist. No, I think we've solved that. I think the not speaking and the lethargy was because of severe dehydration. So he can speak now. We could ask more about what he's eaten and when he's gotten sick like that. But let's send him to the gastroenterologist. Okay, especially since at this hospital, it doesn't take much time. In reality, this is going to rack him up a $10,000 bill. But I guess we're doctors. We don't care about that. We'll let the administrators sue him into bankruptcy. All right, let's see what the gastro... The other thing is he's alert now, so he can answer questions of the gastroenterologist. So that might be the best way to get information from him that we're not allowed to ask him. The gastroenterologist says, I can't tell you much without more data. Either take an abdominal CT scan or try a stool culture. Okay, so all of my complaints about the gastroenterologist being too powerful sort of got negated. Now notice the gastroenterologist says do an abdominal CT scan, but we know he's allergic to contrast dye, so we are not going to do that. But the channel asked us, someone in the channel suggested before about a stool sample. So let's do a stool culture. Now notice, that's for bacterial infections. That's just gonna, but I guess it's gonna rule out whether it's a bacterial infection, which might be helpful to us. Okay, but before we can do that, we have to do a status update. Now, because he's alert and sick, that's not going to be as bad as before. So SDD. It would be nice if this had a place where you could write down that it was SDD. Okay, let's look at his update at 2 a.m. We were already going to get him through the night. Story cards 9 and 10. Okay. 2 updates. Very interesting. 9 and 10. Why don't we, these are short games, why don't we take our little break a little, have we been taking breaks with this game? I don't think we needed a break in our last game. We solved it so quickly. Alert but still sick. Why don't we take a break between days to give us a little more suspense? Don't do too much outside research. It feels like you might solve some of this if you just went on Google Chat and gave it the symptoms. Chat GPT, I mean, it might come up with the answers. Let's take our little break here. We'll come back. We'll find out what's happened at 2 a.m. Okay, we're back. I have some thoughts, conflicting thoughts about whether it could be bacterial infection. It feels like it's more likely irritable bowel syndrome. It's happening to him so frequently. Some possibility that his wife is forgetful and is feeding him food that's making him sick, but there's no point discussing it before we take a look at what's happened at 2 a.m. So let's go through that now. When you check on Adrian, Thea pulls you aside nervously. She says, all these tests, how much are they going to cost? Not that we wouldn't do them, but you know, Adrian usually takes care of things like this. You assure Thea that Adrian's tests are covered. She sighs in relief. Okay, first mention of costs in the game. I'm very happy to see it here, but I don't know if we should be assuring her the tests are covered. That feels like I'm not sure we would really know that. Thea says, I work hard to take good care of Adrian. I feed him well and save what I can by shopping the specials at Bargain Food or less. It takes extra time to shop the specials, but I have plenty of that at my age. A few months ago, they had canned chicken Adrian likes to have on a salad and fancy peanut butter for just $2 a jar. Can you believe it? I get all sorts of bargains: honey, ham, canned tomatoes, even sardines. Last week they had salmon, freshly caught, not farm raised, and eggs. They always have great deals on eggs. He's eating much healthier, so I don't understand what's happening. Okay, well, this was my theory, sort of, that it is not, that it's wife related to stuff, but not that she's forgetful. But boy, this seems like a strong indication that the wife is buying expired foods on sale. And now we could have a bacterial infection from salmonella, from the eggs, or expired stuff. So I think we've got a huge clue now. And I was going to suggest that we maybe think about asking her some questions about what he's eaten, but she's now volunteered stuff for us. I think we've got a very strong possibility now to the, and that's understating it, that what's happened is he's got a very sensitive bowels, his stomach is sensitive. I should learn that word. And she's feeding him like constantly iffy food that's expired and maybe has salmonella and other bacterial infections. So now I've warmed on the idea of doing a stool sample and finding out if it is bacteria. But a bigger problem, the reason it keeps happening is because he's got sensitive stomach and she's buying constantly food that's on the verge of being is not edible. It's makes sense. Like if you've got a strong stomach, then a little bit of bacteria in your food's not going to kill you. But if you're susceptible to it, there you go. Okay, so chicken, eggs really feels like could be salmonella here. So, and then she's worried about cost. So let's not do things that are going to cost her money, although this doctor seems to think it's covered. I'm not so sure. Channel was saying they got Medicare, but they still got to pay something. All right, so pretty cool. Now that we suspect it's food poisoning of some sort, let us look at our drugs now. I mean, they're going to run a test to find out. If it were me, I'd be like, just give him the antibiotics and see if it helps it. But probably before he leaves, we're going to want to give him the antidiarrheal. But if it's an infection, but it's not an infection, we think it's going to be, what does that mean? Infection, would bacteria count as that? So you wouldn't give someone an antidiarrheal if they had a bacterial infection? Let's look at what these are. So ceftriaxone is one of these is going to be penicillin based. Look at that. Avoid this if patient has a penicillin allergy, which he does. Okay, so we are not going to be giving him ceftriaxone antibiotic because he's got a penicillin allergy. This one is going to be an antibiotic that's not penicillin. Okay, ciprofloxacin can cause adverse side effects, including diarrhea, vomiting, and nausea. So ceftriaxone is preferred if appropriate. Avoid use if patient has ever had seizures, epilepsy, narrowing of blood vessels near the brain. So neither of these are ideal antibiotics, ceftriaxone or ciprofloxacin. Epinephrine is not an antibiotic, so I have a feeling he's going to have a bacterial infection we're going to treat with this and give him an antidiarrheal. I'm not sure though. Let's just look at what epinephrine sounds like. That's a heart thing. That's not, or allergy. Okay, so if we thought it was an allergy, we would give him epinephrine. I don't think it is an allergy anymore. So here's my suggestion to us. I suggest we run a stool culture, confirm it's a bacterial infection, and then give him, if so, ciprofloxacin and an antidiarrheal. These two combined should take care of a bacterial infection and treat the diarrhea that the antibiotic might otherwise make worse. Probably why he doesn't like going to the doctor for this stuff, because it probably aggravates and maybe even had an allergic reaction. Okay, so is the channel on board with that? Of course, if something comes back from the stool culture that shows it's not a bacterial infection, then we'll change our plan. But what do you think about that? Stool culture, and then, assuming so, we give him the penicillin-free antibiotic and the antidiarrheal. That's my pitch. The other, let's see, if you just look at the questions, let's see, what happens when he goes golfing? What is he eating? I don't think we need those questions. Despaminite says sounds like a plan. Okay, so stool culture is our first thing we're going to do. We're going to have this guy out of here by 4 a.m. Okay, stool culture, J-U-H. Is my handwriting any better today? J-U-H. Okay, here we go. Story card 28. If all goes well, you don't see that many of these cards. Okay, let's see if he's got salmonella poisoning. Yep, there we go. The gastroenterologist shows you the stool culture results. Well, this explains a lot. Your patient has salmonella. Okay, as I expected. So you can see what they do when they do a culture. If you're not familiar, they put this tray of agar, is it? It's like a food. And then they put it's certain food, I guess, that different bacteria like. And so they streak some of his stool sample. They just streak it through here and they see what grows. It takes some time for it to grow. And then it's grown and they've seen, okay. So then, is that how it works? Do they have different trays that different bacteria like, so that the only thing that would grow on here would be salmonella? Or is it that anything would grow here, and then when it grows, they can look at it and see that it's salmonella? That's the part I'm not sure about. Anyway, okay, we've got salmonella. Now, we've basically cracked this case. But let's look up salmonella and see salmonella poisoning. Let's see if there's some special treatment for it. Here's salmonella. Bacteria that can cause inflammation in the small intestine and colon. Incubation period is 6 to 72 hours. That's why it takes a couple days before it really got bad. Stools are loose and bloodless. Diarrhea typically resolves within 3 to 7 days. So it's going to take care of itself, I guess. Fever, abdominal cramping, chills, headache, muscle aches. That makes sense. He's got some muscle aches. The most common sources of salmonella include beef, poultry, and eggs, although almost any type of food can serve as a source for infection, including improperly prepared fruits, vegetables, dairy, and shellfish. Stool culture will confirm presence of the bacteria. Imaging is not usually done. If the symptoms are severe, consider antibiotics, then identify the source. Okay, well, we've identified the source. It's the wife buying this food to save money. You can't fault her, but she has to stop trying to buy fresh fish. Dispamonite says, I think it's that anything grows, and then they look under the microscope to see what was growing. Okay, so the wife's not going to be happy to hear that she's to blame, but I guess, don't try to buy fresh salmon at the dime store from the expired cans. Okay, so now we've got to decide how to treat him. It's an interesting issue here, because this might be if I was the doctor, I might call Adrian in and say, look, you got two choices. I can prescribe some antibiotics for you, not the penicillin brand, but the ciprofloxacin. Maybe the first thing you'd say, hey, look, have you ever had ciprofloxacin before? How do you tolerate it? Assuming he hasn't, I would say, look, you got two choices. You've obviously been through this kind of thing before. You got a wife who feeds you this food that's going off. I can either give you some antidiarrheal and send you home, over-the-counter antidiarrheal, send you home, and you can just survive it on your own, stick it out. Or I can give you some of this antibiotic. It could make your diarrhea worse for a bit. Make sure you have plenty of fluids, and ask him what he would prefer. And Tina says, why isn't she sick? Well, I think your body can fight off a lot of this stuff, but some biomes and some are not as good as others. So he's just very sensitive to it. DJ Moneycut says, did we ask what he ate this week? We didn't. It's possible. I mean, it's an interesting theory. Okay, so before we go, I was talking about treating him. So you're right. I'm jumping to the conclusion that he's got salmonella from the food she bought, but she says it happens when he goes golfing. So it's also possible that it's not her food. It's not the food that it seems to be, but that it's possible he's eating some food at the golf course. I guess you buy a sandwich with mayonnaise, you take it out all day in the sun. Maybe it goes bad. Salmonella. I guess it's possible that it's not from her food. Well, let's take both of these in turn, though. Let's take both of these in turn. I hear that the channel wants to investigate and confirm whether it really is the wife's food, even though it sure seems like it to me. But let's do this first, since it's a separate issue where he's getting it. But I agree, before we give him advice, we better be sure. But okay, let's deal with the other thing first. How are we going to treat him? Does everyone agree we should just prescribe him the antibiotic that he's not allergic to, but could cause diarrhea and then give him an antidiarrheal. But what about this? Caution should be used if the diarrhea is caused by an infection, which it is, as it could cause the infection to worsen. But it feels like if you did both of these, you'd be okay. This is a little tricky question. I'd want to look this up if you're a doctor, though. Don't you think? Like, this is just saying don't give an antidiarrheal if they've got a bacterial infection, which he does, just alone, because this could make it worse. But if you give these two, it feels like that's fine. Like, the ciprofloxacin's going to kill the infection. It's not going to get worse just because you give the antidiarrheal. So I feel pretty confident, having not gone to med school, that this would be our treatment, this combination. But the channel can think about whether you agree with that. Okay, but then the channel is saying, well, before we continue, though, they want to pinpoint what really got him sick, huh? So I hear what you're saying. She's not sick, and it happens when he goes golfing, but my read of it is that she just doesn't want to get blamed for it. And that's why she's saying, it seems like it's really, I don't think it's the health food I'm giving him. It's not my food. It sounds like what she's saying. It's probably when he goes golfing, he gets sick. It usually happens after he goes golfing. I think he's eating some junk that doesn't agree. So I don't really buy it. I think it's her food, but I guess we've got some time. Let's ask two questions. All right. So what if we're curious about him eating something while golfing? It seems like what happens when he goes golfing is the first question. And then either question 3 or 4. I mean, she seems like she's told us what he's been eating in the last week. Salmon, eggs. They always have great deals in eggs. He's eating much healthier, so I don't understand what's happening. All right, we're going to ask a couple more questions before we accuse her of being the cause of all this. We're going to check out the possibility that he's eating junk food at the golf course, but I think he's just bringing a sandwich from home. So that's what I think we're going to get confirmed here, that he brings his food from home. But let's see. Okay, so we're going to ask question 1. We'll start with that. What happens when Adrian goes golfing? PUQ. Let's see what she says. What happens when Adrian goes golfing? Let's take story card 6. Okay. If you ask me, I think this golfing's the problem. It's the sun. He gets too much and it's not good for him. I try to tell him to take a hat. He takes the hat to quiet me down, but I know he doesn't wear it on the green. And sure as God made grass green, every time he goes golfing, a day or two later, he starts feeling sick, just like he is now. Well, usually not as bad. I'm afraid he might have... She looks away as if not wanting to face some awful truth. Finally, she turns to you. Is he going to be okay? You assure her you are going to do everything you can for him. Okay, well, it's a good thing that finally this doctor didn't overpromise. He's like, I'm going to do everything I can. I'm not going to tell you he's going to be fine. They probably train you as a doctor early. You can't promise people everything's going to be okay. But she is pretty confident this happens when he goes golfing. I feel like we should be asking him if he eats anything at the golf course. Take a hat. He takes it. I mean, the heat stroke is making it worse, but it doesn't really... All right. It didn't really help us much. What's our second question going to be? I guess 3 and 4 are the questions we want to ask. What has he eaten? Has he been sick like this before? It feels like we know the answers to those questions, but we do get one more for free. Which one? Let's see. 2 people don't agree with giving the antidiarrheal. 3/4, she already told us 4. Three over 4. So you want more specific about what he's eaten. Okay, maybe I want to hear her tell us she packs him chicken tuna salad for lunch is what I want. Okay, DJ Moneycut says he wants the answer to 3. Okay, so everyone wants 3. So here we're going to say question 1 and question 3, which was PUQ, and question 3 is LXH. All right, we're going to ask her more specifically what he's eaten in the last week. Specifically, I want to know if she packed him lunch at the golf course. Okay, LXH, story cards 7 and 8. Okay, so we're going to get more details about what he ate. Maybe she's got some in her little Tupperware she's going to give us, and we can run a culture on it. All right, here we go. 6 months ago, the doctor said I need to keep him active and told me to put him on a diet. It's not so easy telling a grown man he can't have his favorites. My Adrian, he's more stubborn than a mule, but I'm smarter than a mule. I can tell you exactly what he eats because he eats whatever I make him. I do all the cooking. Early in our marriage, he tried to tell me what to cook, and I told him I didn't tell him how to pay the bills. I buy fresh vegetables from the farmer's market in the village. I do the rest of my shopping at Bargain Food for Less. Here, you can see the receipt. I do what I can to save money. They had that canned chicken on sale last week. Anyway, we both eat exactly the same thing every meal. We usually have oats in the morning and share a banana. I'm not sick, so it can't be the food. What does he snack? Does he snack or sneak food? I know he doesn't sneak any food. Well, he does sneak a tiny chocolate candy once a day. They're my favorite. He thinks I don't notice, but I can tell. I'm the reason Adrian is still alive, me and my cooking. If he ate the way he ate when I met him, he would have been dead a long time ago. She pauses, then becomes quiet. Take card 15. Okay, so she does all the cooking. All right, now, please tell me you pack him lunch for the golf course. Is she just concerned about him, or is she going to tell us something about making... Oh, here's the receipt. All right, what have we got here? Ham, half and half, flour bunch, frozen salmon, happy chicken eggs, canned chicken, bananas, and sardines. Well, that's interesting. I mean, she's eating everything too. Why isn't she getting sick? What is he eating at the golf course? Is it possible? I mean, my gut tells me that she's just got a stronger stomach than him. But it sounds like the channel is not as convinced. It can't be the chocolate he sneaks because they're her favorite, so she eats it too. We eat exactly the same thing. Well, if it's something he's eating, if he's getting salmonella, it's very suspicious coincidence that she's buying these off eggs at the bargain store. I just think that she's, got a stronger stomach. But if we thought he was sneaking food at the golf course, what would we ask? What would we do? Well, who has he been in contact with since he first had symptoms? That doesn't seem relevant for us. Doesn't feel like those questions would help. I think she's just got a stronger stomach. Well, it's time to decide. We could give him the antibiotic. The channel doesn't want me to give him the antidiarrheal. Well, let's give him the antibiotic. He's got salmonella. He needs antibiotics for it. Okay, so I think we treat him right now with the antibiotic, making sure it's not the one that's got penicillin. So we want the ciprofloxacin. Okay, so the ciprofloxacin is FPC. Just confirming that it's the one that does not have penicillin. Ciprofloxacin. You don't give celltrioxone to penicillin. He's not got any signs of this. Okay. Let's give him this. Let's see if he starts having, if his diarrhea worsens. Anyone disagree with this? Surely we have to give him an antibiotic for his salmonella, right? Let me just see here. Yeah, surely. Nothing else to give him. All right, we're going to give him FPC. Let's see what happens. And then we'll start talking to him, see if we can figure out what he's done. Story card 30. Then maybe we'll see if he's eating anything at the golf course. Status is alert and improved. Adrian's cheeks are red and he's laughing with Thea. You have dealt with his symptoms. He's out of danger. Congratulations, Adrian has survived the night. As you leave Adrian's room, the hospital director pulls you aside. Hey, good job with the old man, she says. However, it's important you find out the source of his illness. Depending on how he contracted it, this could impact a lot of people. Okay. So, status card 4. We've treated his problem. He's alert and improved. He's going to have some bad diarrhea. Ah, look at that. Look at what's happened. We can now interview him because he's better. Now we can ask him about his state. And look at this. You can still give him an antidiarrheal. He may start complaining about diarrhea. Okay. So, however, before we can do that, so probably we shouldn't have wasted our time talking to her, although I guess it was good we got more information about that. Okay. Now we're going to get status, although we've got this thing. I wouldn't be surprised if he doesn't have serious diarrhea, but he is improved. Okay, so first we got to do ZZZ. Condition 4 a.m. ZZZ. Thea is sitting next to Adrian, who's sitting up in bed. Am I ready to go home yet? He asks cheerfully. Not quite yet. It's good the doctor of the hospital said we should worry about where he's getting where he got salmonella because other people might get it too. Okay, so he wants to go home. The chat doesn't want me giving him a diarrheal. This is actually a real medical question we have here at this point. I'm going to tell you how I read it, and you tell me. The chat doesn't want to give him an anti-diarrheal. Why? Because I'm not saying I'm going to insist that we give it to him, but the reason the chat doesn't want me to give him an anti-diarrheal is because it says caution should be used if the diarrhea is caused by an infection because it could worsen the infection. Now, when I read that, I read this to say that if you prescribe someone an anti-diarrheal with an untreated bacterial infection, you could make it worse. But the antibiotics are very strong. So my guess is that it would be completely safe to prescribe an anti-diarrheal once someone's on a course of antibiotics and you know that that's going to treat the underlying infection. So my guess is, we could check this at the end, my guess is that this would be completely safe and would give him a little more comfort. But he's a tough guy. He can survive without it. So I'm okay with not giving him this. When we talk to him and we let him out, I might maybe call up the specialist, say, look, it says it's counterindicated, but given that he's on the antibiotics, can I give him this? Maybe the gastroenterologist will say, look, should be fine. He's got the antibiotics, but he's a forgetful old guy. What if he stops taking the antibiotics early? Then this is going to make it worse. Or what if he starts using these next time? So maybe they'd say don't give it to him. I don't know. We'll talk about it. All right. Now, more importantly, let's call him in and ask him what he's eating at the golf course. Is he bringing food from home? Or is he eating some food at the golf course? But wouldn't other people be getting sick at the golf course? I think he's going to say he packs some chicken egg salad. Egg salad, that's my guess. He's going to have brought egg salad with him. On the golf course, he carries around in the sun all day. That's how he's getting it. That's my guess. Okay, story card 2. And this one we've already seen. So these questions we already know about, but this is new. All right, story card 2. So at 4 a.m., we're doing interview. Okay, here we go. We're going to crack this case wide open. It's going to be egg salad packed from home. Let's see. Adrian's no longer confused and is able to answer your questions. It's challenging because his wife keeps interrupting. You get a nurse to distract Thea by having her pick a drink for Adrian so you have time to ask him one question. How do you think you got sick? And tell me what happens when you golf. Look at that one question. Doesn't really say, we can't ask both of them, but it just says like for each question, it's going to take a full period of time. All right, well, what do you think? Let's have a little vote here. All right, what do you think? Question 1 or question 2? Type vote 1 or vote 2. The star votes for question 2. The Spamonite says question 2. I mean, I agree. We don't really want him to try to diagnose what made him sick. Just tell us what happened. We'll figure it out. We're the doctor. Perry says question 1. Perry says, trust the old guy. He'll know what's making him sick. DJ Moneycut says question 2. Also, and so does Antina. So we've got 3 votes for question 2. I'd be inclined to say question 2 as well. Tell me what happens when you golf. Specifically, what food are you eating when you golf? All right, so we're going to stop this vote here. All right. Adrian, tell us about your day when you go golfing. Specifically, I want to know any food you eat from morning to night when you go golfing. Is there anything different about your diet? Let's see what he says. Take story card 33, then take story card 34. Okay, here we go. He's going to tell us about his golfing. There we go. I really look forward to my golf day. The guys and I take the train to Queens and shoot the back 9. Takes about 2.5 hours. I'm not as young as I used to be, so walking takes a lot out of me. Thea packs my favorite lunch to keep my energy up until we can have lunch at the club. I usually have an Arnold Palmer, just one. You know, half tea, half lemonade, and just a splash of vodka. But you can't tell Thea. She doesn't know. Don't know what, says Thea, who just returned to the room with a drink in hand. Adrian pretends to cough, and Thea hurries over to fuss over him. Okay, so he packs a lunch. No, he packs my favorite snack to keep my energy up. That's banana and peanut butter. So, banana and peanut butter is not going to make him sick. It's not going to have salmonella. Then and he has lunch at the club. At the club, he has a drink, an Arnold Palmer. That's a drink with a little bit of vodka, a little bit of, we're told what an Arnold Palmer is. Arnold Palmer was a famous golfer, and this is a drink named after him. Tea, lemonade, and a splash of vodka. Well, this is not what I thought. I thought he was going to be packing tuna salad. Okay. Huh. Congratulations, Adrian has survived the night. You continue your rounds to check on other patients. When you return, you're surprised to discover an empty room. When you check in with the nurses, you learn that Thea convinced one of the other doctors to release Adrian to go home. Whether you're ready or not, it's time to fill out your final report. So look how clever that was, that you only got the one question. DJ Moneycut says, I think fruits can have salmonella. Well, she did buy bananas. Let's look up salmonella again. I thought salmonella was chicken and egg. Where's our salmonella? Incubation period is 6 to 72 hours. Beef, poultry, and eggs, although almost any type of food can serve as a source, including improperly prepared fruits, vegetables, and dairy products. Oh, I wonder. Okay. All right. Okay, I think I got it. I get it. Let's see. Probably the chat's coming up with this too. Where is her... all sorts of bargains. Chicken salad on... canned chicken on sale. We eat the same thing. It can't be the food. He doesn't sneak in any food. He has chocolate. It's my cooking. We eat the same thing every meal. I think there's our key right there, right? I think the channel is right. Where's her thing about how when he was growing up? Okay. When he was a boy, he had his mother make his favorite snack after school every single day. A banana with a smear of peanut butter, something to give him a little energy. Okay, so I have a theory. Yes, okay. There you go. A channel has got it too. Okay. She says she doesn't like nuts. They have all their meals together. He has his lunch at the club. So what has happened here? What has happened here? When he goes golfing, she prepares a snack for him. The snack is peanut butter that's got some a banana with peanut butter smeared on it. She doesn't eat the peanut butter with the banana with peanut butter smeared on it. That's only him because she doesn't like nuts. So I think what we've got here is probably like she's chopping up all this bad chicken and stuff with salmonella, and on the cutting board, she's preparing his banana and peanut butter, and it's getting raw salmonella on it from the expired chicken and eggs and stuff. But it's getting on, it's not being, normally when they eat it, it's all cooked out, so it's fine. But on his improperly prepared banana and peanut butter, I think it's holding the salmonella. So if I had to guess, we're all in agreement. It's getting to him through his snack, which is the peanut butter and banana. The only question we're still, I think maybe we could debate about is whether the salmonella is actually in the expired peanut butter or if it's being improperly prepared by her and spreading onto it. That would be my guess. My guess is she's using a cutting board that's got salmonella from the chicken and eggs, and it's getting onto the raw banana and peanut butter. That's my guess. Okay, so we're ready to send them home. We can't ask them any more questions, but we could check out some other stuff. That's very cool that it knows this is the last thing we should see. Okay, so, what caused the symptoms? We're going to say salmonella and dehydration. Right? Treatment, we had an IV fluids to treat his dehydration, and then we prescribed to him the ciprofloxacin antibiotic. Okay. Recommendations. This is the more interesting stuff. So I'm going to tell him, I'm going to give him a prescription for an antidiarrheal. But don't, oh, he's gone. He's gone. Well, I guess we know his home address. But don't, maybe what we'll say is, if cleared by allergist, or not allergist, we'll just say specialist. In other words, here, I'm going to make it even better. We should be worried that he might be taking antidiarrheals, which are making it worse. That could be what's happening. He could have a whole medicine cabinet full of antidiarrheals because he has irritable bowel syndrome, and that could be making his bacterial infection's worse. So what we're going to do is we're going to talk to a specialist for this guy, and we're going to find an antidiarrheal that's safe to take that won't exacerbate bacterial infections. So we'll do the best of all worlds. We're going to find him a specific antidiarrheal that's safe for bacterial. Right now, everyone's happy. We're not going to send him on with the generic one that's going to exacerbate it. So safe for bacterial infections. Best of all worlds. Okay, now, the other thing is our advice about the salmonella infection. What are we going to tell the wife? And do we need to contact the store? We need to give her food prep. So I need to have her make sure when she makes the banana and peanut butter that gets prepared completely separate from any poultry stuff. Yeah. So cutting boards, etc. Those all have to be kept very separate, and she has to be much more careful about cleaning and disinfecting. And then possibly consider stopping shopping at the bargain place. But I mean, they're on a fixed budget, so that may not be easy said than done, but especially the peanut butter. Because we're not yet sure if the salmonella could have been in the peanut butter. And in fact, maybe contact store about peanut butter. Now, my theory is it's not actually in the peanut butter. My theory is that it's spreading from the chicken and eggs to the peanut butter. But any theory, any disagreements here? Any thoughts? Anyone want to add anything before we read the epilogue? DJ Moneycut says, I suspect the eggs or the bananas. I don't think you have salmonella growing in peanut butter or bananas by itself. I really feel like that's improper preparation that spreads the salmonella onto the peanut butter and banana. That's why I'm fairly certain it's her prep that's doing it. I don't think you would find salmonella naturally occurring in peanut butter or banana. All right, let's do it. Epilogue time. Here we go. He's already gone home. Makes sense. That seems realistic. All right, everyone's on the record. Any disagreements? Here we go. Adrian's confusion and lethargy are concerning. He might even have brain damage from his fall in the bathroom. A CT scan of his head shows that his brain has some atrophy, but indicates no immediate risk or brain damage. The doctor did exactly what I wanted to do. Quick CT scan first. His diarrhea is alarming for a person of his age. He's likely dehydrated, which could lead to kidney failure. While an antidiarrheal will provide him some relief, it does not address his more critical need to rehydrate. Hydrating Adrian with IV fluids makes him more alert and prevents potential kidney failure. Next is Adrian's mysterious illness. By talking with his wife, Thea, you can learn that his illness has happened before, always a day or two after he goes golfing with his friends. Given that the illness has caused his diarrhea, you have the option of taking an abdominal CT scan or a stool culture. An abdominal CT scan requires a contrast dye to take a good image, but Adrian is allergic to contrast dye. A stool culture is a more appropriate test. This reveals that Adrian has salmonella. If you delay discovering this, the combination of dehydration and salmonella could result in sepsis, where the infection triggers a chain reaction throughout his body. Antibiotics are the best course to treat salmonella. While ceftriaxone is typically preferred over ciprofloxacin because ciprofloxacin's side effects, Adrian's allergy to penicillin eliminates the use of ceftriaxone, as it may cause him to have severe anaphylactic reaction. If Adrian were to have such a reaction, epinephrine might need to be administered immediately to prevent death. So if you give him the wrong thing, you can re-prescribe him epinephrine to counteract that. With IV fluids and the right antibiotics, Adrian's situation can be stabilized so he survives the night. However, salmonella represents a potential threat to others. You need to identify the source to prevent Adrian or others from contracting it again. But Adrian and Thea eat the same food. So why doesn't she have salmonella? And why does Adrian keep getting sick? Sometimes the patient and their family hold the clues to their condition. Thea is worried about Adrian and her thoughts are somewhat scattered. Her recent grocery receipt doesn't give us any clues because this problem has been going on for months. Of all the foods Thea mentions, only the canned chicken, sardines, and peanut butter have a shelf life over several months. Over the several months, Adrian's condition has reoccurred. As you talk with Adrian, you learn that when he plays golf, he has lunch and drink from the club. However, if this were the cause, other people would have been affected as well. But Adrian brings a snack with him that gives him energy. Thea shared that Adrian's mom made him bananas smeared with peanut butter as a child to give him energy. She also talked about having bought peanut butter a few months ago, even though she doesn't like nuts. It seems Thea overlooked that she makes Adrian a peanut butter and banana snack when he goes golfing. It doesn't take much effort to find out what kind of peanut butter Thea bought and discover online that it was recalled for salmonella because 9 other people died. Based on a true story. Congratulations. Not only have you saved Adrian, but you have prevented others from being infected as well. Okay, here's our scoring. 50 points if he survived the night. Okay, there's our 50. 10 points if you confirmed he has no brain injuries with a CT scan. Okay, we did that. 10 points if you hydrated him before 4 a.m. Pretty cool. Okay, we did that. In fact, we hydrated him right as soon as he got in. So that's another 10 points for us. Okay. 10 points if you gave him antibiotics before 6 a.m. We sure did. 20 points if you uncovered peanut butter as the source of the salmonella. If you didn't, he's back in the hospital a few weeks later. Well, we said contact the store about the peanut butter. We suspected it was actually food preparation issue, but we did secondarily suspect the peanut butter or the bananas, but more specifically the peanut butter, because we thought she might eat the bananas, but she wouldn't eat the peanut butter. So I'm going to give us points for that. I'm not going to take away any points because we did suspect. And in fact, if we contacted the store about the peanut butter, they would have looked it up online and found that. Minus 10 points if he went into anaphylactic shock because we gave him the wrong antibiotics. And minus 5 if we had gone past 8 a.m., but we didn't. We didn't even go past 4:30 or so. Okay, 60, 70, 80, 100 points. So perfect score for Adrian. The only thing that you might subtract some points for is we're basically going to accuse the wife of bad food prep. And that would not be fair to her. And Tina says, if it was food prep, it would mean every time the food would be contaminated. Yeah, maybe. All right, so maybe we lose 5 points for accusing her of food prep when it was really the peanut butter that needed to be recalled based on a true story. All right, that was a fun case. Any thoughts? Normally we would take a break and come back and talk more in detail about the game, but I feel like because there are continuing cases that we might as well wait to do that when we play our final case. The Spamonite says, I said the peanut butter, so I am taking the full 20 points. Okay. So 95 points for me. Anyone who I talked into thinking it was food prep gets a 95. All those who are sure it was the peanut butter get the 100. All right, that was a very fun case. I like the double symptoms, the possibility of brain injury. I like the mechanic where we only got one question, then they left the hospital. I like that she was asking about the costs. The cases are getting better. I am very curious to see what a hard case looks like. So this was a level 2 difficulty, did we say it was? Yeah, this is 2 out of 5 difficulty. Our next case on Friday is also going to be 2 out of 5. And then we've got a 3 out of 5. We have a 1 hard case later. I will note that for all of the cases, we've solved them quickly with plenty of time to spare. But you could see if you got something slightly wrong, it was very cool. It was saying, like, if you had given him the wrong thing, it's not that the case is over, but then you have to give him the epinephrine to cure him. And then lots of cards we didn't see. Here he is going into shock. I continue to be impressed by this game. Okay. So in 2 days, I'll see you for patient number 3. And then the plan is to play patient number 4, I think, on Sunday. It's possible we can even do it Saturday. But I think probably Sunday. And then also Sunday afternoon at 3 p.m. will be the finale of Dear Holmes. What did you guys think about it? Let's see. Any other thoughts? How would you compare it to the previous case? Better, right? I liked the previous case too. This one was fun. It was fun to talk to these two people. I like the development after they change status. Different things become available. Let's see what would have happened if we had given him the antidiarrheal. Let's see if the channel was right that that was bad for him. The score didn't say anything. So DYW, if we'd given him if we had tried to give him the antidiarrheal, it says, Adrian appears to be getting some relief from the antidiarrheal. Now he won't have to relieve himself as frequently. So actually, I was right. If you had given him the antidiarrheal, he would have been fine. So I'm going to go back and put myself back up to 100 because I was right that the antidiarrheal was fine to give him, even though he had salmonella poisoning. Isara says, this was really fun. I like the dialogue and the dynamic between the husband and the wife. The Spamonite says, this one was good to have to avoid the contrast dye and the penicillin. It's fun to remember to avoid things. Someone should make a bonus case for this game where you give the person the wrong thing and then you have to go through a whole legal cover-up during the lawsuit and how the hospital denies. Maybe 2 cases. One case where you prescribe the wrong thing and the patient dies, and then there's a whole legal cover-up and you have to figure out how you work with the hospital to avoid paying out to the family. And then the other bonus case could be the flip side of that, where you do everything right and you get sued by the family for $10 million and the hospital settles for $1 million, even though it's a total scam and you did nothing wrong. And then your insurance premiums go up and you get fired. I like to see those two cases. That seems a little more realistic. DJ Moneycut says, cases have been pretty realistic and straightforward, which is good, but not really grabbing me, almost too realistic. It's interesting how a couple people, and Tina says, no extra points, Jesse, don't cheat. It's interesting how some people are being, are really getting into this game and other people are not quite being grabbed by it. Yeah, it is interesting to me that some people are not, maybe because it's just too easy, that it feels a little more mechanical. This one had a little bit of deductive element, figuring out where he's getting poisoned from, that wasn't purely mechanical. I really did appreciate that, but I think this is a great game. Okay, thank you for joining me. A real pleasure, as always, to have this group to play with. Seems like we got a little bit of a different group playing this game than we have with some of our serial killer murder games. Always fun to hear from all of you. If you play this game outside of the channel and have just stumbled on this video later, I'd love to hear your thoughts in the comments. I do read all the comments and try to reply. It's fun talking about these games. I'll see you all in 2 days on Friday for patient number 3. See ya.